Dr. Kyle with Project Wellness Company. We've talked a lot about shoulders and shoulder issues, and all too often we're going to get a lot of tightness up across this top. Okay, you have a muscle that sits right on the top of your scapula called your supraspinatus. That muscle comes out and controls a lot of function out into that shoulder. And then as well, we have other muscles down on the scapula itself, which would be our infraspinatus, our teres major and minor, all involved in that shoulder girdle and how that shoulder is functioning. And so if we're having shoulder issues, we're having a lot of issues up in the tops here, we want to do certain stretches and exercises in order to loosen those up. And so one of the ones that I do a lot within the office is I'm going to come in. We have a muscle that attaches off the base of our skull here that comes down into the angle of our scapula, which is called your levator scapulae. And so a lot of times when we're having posture related things, this muscle is going to get really, really tight right on the attachment of the scapula itself. And so what I want to do is I'm going to contact that area, apply a little bit of pressure into it. And then what I want Dr. Bailey here to do is she's going to start at her pocket here, and then what she's going to do is bring her arm all the way up to the top, allowing her bicep to touch her ear, and then she'll go back down. And so while I'm contacting that, what we're doing is we're loosening those muscles up. So I'm having her go through an active range of motion of that shoulder on her own, and my pressure, what it's doing is it's working to break up any adhesions or muscle spasm, tightness in that top of that shoulder, which ultimately is going to allow her to have better function in that shoulder, taking pain out of that shoulder off the top of the spine, and essentially helping to get rid of some of those spasms that we have down and through here. Now typically we're going to do 5 to 6 reps on that, covering a lot of these different spots here within that shoulder. And then another one that we're going to work on is down in the scapula itself. These muscles here attach out into the shoulder here. And so I'll have her do 2 different movements. Okay, we'll do the same one where she's coming from her pocket to her overhead, all the way like this, working on a lot of these muscles down and through here because they're going to be at a full stretch here. And then the other one as well is I have her bend her elbow to 90, and she's going to be internally and externally rotating that shoulder while we're working on these specific muscles. Okay, so I'll have you start with the pocket to overhead here. And so what I'm going to do is I'm going to contact right in through here on her shoulder, right on some of those muscles that I just mentioned, and I'm going to have her go through that range of motion. And so I would contact them, and then have her go ahead and start moving her arm. And we're going to be working through loosening those specific muscles up as she's going through those ranges of motion, allowing them to be freely moving, getting mobility back into the shoulder, and ultimately helping to get rid of some of the pain and restrictions that we would have within those muscle bellies that actually control the shoulder itself. Okay, now the other one, we'll go 90-90. Okay, same spot. I'm going to be moving to different regions because there's a lot of different muscles that we want to catch as we go across here. But I'm going to be coming in there, contacting those muscles specifically in that area again, and then I'll have her start rotating that arm internally and externally. Trying to keep that elbow nice and stationary as we're going through these, because then we're just focusing on the shoulder moving itself and those muscles that are coordinating that movement as she goes through those different movements. So this is going to be really effective at loosening those muscles up, ultimately giving us freedom back into the shoulders. If we notice we can't get our arm up overhead, okay, bring it all the way up to the side. That's going to allow us to free those up to get more mobility in that shoulder and get it back functioning properly on a day-to-day basis.